Okay, so picture this. You get your annual physical. Your doctor looks at your chart, tells you your cholesterol looks normal, and you breathe a huge sigh of relief. But what if I told you that number, the one we've all been trained to focus on, is missing a massive part of the story? What if the real danger to your heart is hiding in plain sight, just beyond what a standard test can see?
You know, this is the exact question that stumps so many people, doctors included. It's the central mystery we're going to try and solve in this explainer. If the usual suspect, that total cholesterol number, seems to be under control, then why is the crime, the heart attack, still happening?
Well, the answer is actually pretty simple. We've been looking at the wrong thing. It's like we've been reading the wrong page in the playbook. That standard test, it's a decent start for sure, but it's just the cover of the book. To really understand your risk, we need to look inside. So, let's start digging. Let's find our first clue.
All right, so our first big clue here involves it's a pretty major shift in how we think about this stuff. We've got to stop thinking so much about weight and start thinking about the actual number of culprits.
Okay, let me break this down. The standard test, what they call LDL-C, measures the total weight of all the cholesterol packed into your LDL particles. Think of it like the total weight of all the traffic on a highway. Seems logical, right? But an advanced test, LDL-P, does something different. It counts the actual number of LDL particles, the total number of cars on that highway. And why is this so important? Well, think about it. You could have a low total weight because of a few really heavy dump trucks. Or you could have that same weight from a massive traffic jam of thousands of tiny, lightweight cars. See, it's the number of cars, the sheer volume of traffic, that really jacks up the risk of a crash.
And just like with cars, not all LDL particles are built the same. You've got your pattern A particles. These are the big, fluffy, buoyant ones. Think of them as slow-moving buses that kind of stay in their lane. They're way less dangerous. And then you have pattern B. These are the small, dense, dangerous ones. These are the little sports cars zipping around that can easily spin out, veer off the road, and smash right into your artery wall. That's what kicks off the whole plaque-building mess. And it's no surprise, right? That's why study after study shows that people with heart disease almost always have a ton of these dangerous pattern B particles.
And here's the real kicker. Having a high number of these LDL particles is directly linked to a 1.2 to 1.4 times greater risk of cardiovascular disease. And the really scary part? This increased risk is there no matter what your total cholesterol weight says. It's a huge, massive blind spot in that standard test.
Okay, moving on to our second clue. It turns out heart disease isn't just a simple plumbing problem, like a clogged pipe. It's also an inflammation problem. It's a fire, kind of smoldering away inside your blood vessels.
And we actually have a biomarker that acts like a fire alarm for this specific problem. It's a bit of a mouthful, but it's called lipoprotein-associated phospholipase A2, or just LPPLA2 for short. Now, you might have heard of other inflammation markers. Think of those like a general smoke detector for a whole building. It could be a real fire, or maybe someone just burned some toast. But LPPLA2? It's different. It's a super specific alarm that only goes off when the fire is happening inside your arteries.
And that's the key right there. That specificity is what makes this biomarker such a game changer. It's not detecting general inflammation somewhere in your body. It's detecting it right at the scene of the crime, inside the plaque itself. That makes it a much, much more direct sign of real danger.
But get this, LPPL2 isn't just a passive alarm. Oh no, it's actually part of the arson squad. Here's how it goes down. First, one of those small, nasty LDL particles gets stuck in the artery wall and gets damaged. This damage basically wakes up the LPPL2 enzyme that was just hitching a ride on it. And once it's active, LPPL2 starts creating all these nasty byproducts that act like a flare, calling in all the immune cells and fueling this vicious cycle of more inflammation and more plaque. So because it's both a super specific signal and an active player in causing the damage, high levels of LPPL2 have been shown to be a really powerful independent predictor of future heart attacks and strokes. All right, our third and final clue doesn't have to do with what's floating in your blood, but with the health of the highways themselves, your arteries. You see, healthy arteries are supposed to be soft and flexible. They need to be able to expand and relax to manage blood flow. The trouble starts when they become stiff and rigid. So in this little drama happening inside your arteries, we have a hero, and its name is nitric oxide. You can think of nitric oxide as the ultimate gatekeeper. Its whole job is to tell your arteries to relax, to open up, and to let blood flow smoothly. It's absolutely crucial for healthy blood pressure.
But you know how it goes. Every hero needs a villain. And in this story, the villain is a molecule called ADMA. What ADMA does is it directly blocks your body's ability to make our hero nitric oxide. It basically slaps a pair of handcuffs on the gatekeeper, stopping it from doing its job.
So what happens when this villain, AMDA, starts to take over? Well, as AMDA levels go up, nitric oxide levels plummet. And when that happens, your arteries lose that critical ability to relax and expand. They get stiff. They become dysfunctional.
And wow, this chart right here, it shows you the real-world impact in a huge way. In this study, they took healthy people and had them exercise. Now look at the placebo group. Their cardiac output, how much blood the heart is pumping, shoots right up, which is exactly what you want. But now look at the group they gave ADMA to. Their response is just flat. It's severely blunted. Their hearts just couldn't ramp up to meet the demand. That shows you just how badly ADMA can cripple your heart's function, especially when you need it most.
So over the long haul, high levels of ADMA lead straight to all the things we worry about. Stiff arteries, a condition called endothelial dysfunction, and yeah, eventually higher blood pressure and a much higher risk for cardiovascular problems. Okay, so we've gathered our three big clues: the number of particles, the fire of inflammation, and the health of the arteries themselves. Now let's put it all together and crack this case.
This table, really, it just lays it all out. This is what a real, complete picture of your heart health should look like. Instead of just one data point, you've got three. You're looking at LDLP to count the number of potential troublemakers. You're checking LPPL2 to see if there's a specific fire burning inside your arteries. And you're looking at things like ADMA to see how healthy and flexible those arteries actually are.
And that right there is the big takeaway from all of this. A true modern assessment of your heart health has to go way beyond a single number. It's about understanding how all these things play together. A high number of those dangerous particles can trigger the inflammation, and that constant inflammation can damage the artery walls, which lead to high ADMA and makes them stiff. A single cholesterol number, it just can't give you that kind of insight. No way. So, the next time you're thinking about your heart health, I want you to ask yourself this question. Is your health profile telling you the whole story? Are you just reading the cover of the book, or do you have the information you need to see what's really going on inside? Because looking at these hidden risks, well, that might just be the key to rewriting your own and